Hello everyone, good evening and welcome you to today's webinar on behalf of IAP Digital Media Team. I'm Dr. Bona Raval. We have Dr. Kanchan Kholiya for the topic today on neurological consequences of long COVID. Hello, and good evening. The webinar is organized by Indian Association of Physiotherapists and IAP Women's Health Telangana State Team under the guidance of Dr. Sanjeev Jha, Dr. Ruchi Varshney, and Dr. Prabha Vinod. This webinar is being live streamed on Zoom and also on our official YouTube channel, IAP India. So please like and subscribe us on all our social media platforms to remain updated with the latest events and webinars. And now, without wasting much time, I would like to hand over the webinar to Dr. Himani.
A very good evening to one and all. Myself, Dr. Himani Poddar, Sub-Coordinator IAPWC Telangana State. On behalf of our team, on behalf of Telangana State IAPWC, I welcome you all for today's webinar. The topic for the webinar is neurological consequences of long COVID. And our speaker for the webinar today is Dr. Kanchan Kholiya. And as mentioned by Dr. Bona, our Telangana State team functions under the leadership of Dr. Sanjeev Jha, President IAP, Dr. Ruchi Varshney, Treasurer IAPWC, Dr. Prabha Vinod, South Zonal Head. Our state team includes Dr. Hena Rajshekhar, State Coordinator, Dr. V.V. Manjula Kumari, Joint Coordinator, Dr. Monima Billa, Sub-Coordinator, Dr. Sumeria, Sub-Coordinator, myself, Dr. Himani, Sub-Coordinator, and Dr. Aisha, Hyderabad District Coordinator. Now, I request Dr. Hannah ma'am to convey her greetings to the speaker. Yeah.
Welcome and happy World Physiotherapy Day in continuation of yesterday's celebrations. And really, I want to, welcome my team who have been so supportive for all the programs. And a special welcome to the speaker, Dr. Kanchan. I know you're going to talk about one of the most important topics of post-COVID in neurological conditions, and I'm sure that it would be very beneficial for each one of us on this webinar. So I wish you all the best, my team, and as well as IAP for giving us this platform, and also our treasurer, who is the founder of, I can say, IAPWC, who's been very supportive for women's programs. So it's really a benefit for all of us. Thank you, and I wish you all the best, and handing over the time to Himani. We can't hear
Dr. Himani, you're on mute. Unmute yourself.
Yeah, sorry. Thank you, Hannah ma'am. And now I would like to request Dr. Manjula ma'am, our Joint Coordinator, to introduce our speaker for today's webinar. Over to you, ma'am.
Thank you, Dr. Himani. Thank you, Hannah ma'am. Thank you for your greetings. And I would love to introduce a great learned lady, Dr. Kanchan Kholiya ma'am. Dr. Kanchan Kholiya ma'am, she is a PhD graduate, and she's currently working as Assistant Professor in Physiotherapy Department, Career Point University, Kota, Rajasthan. She is also a consultant physiotherapist at Swarnagiri Neuro Rehab Center, and she worked as neurophysiotherapist at MBS Hospital, Kota, and in IBB College of Physiotherapy also. She worked as a lecturer in Udaipur Institute of Physiotherapy. She is currently working as exam panelist in Gitanjali College of Physiotherapy. She has been a keynote speaker and resource person in various institutes, external examiner and invigilator in various physiotherapy colleges too. And she is very active in government and aided camp programs in conducting them. And Kanchan Kholiya ma'am, I take the privilege of announcing that she has been awarded with Young Achievers Award by World Physiotherapy Conference, that is the 3rd Physiotherapy Conference 2019, and Parirakshak Award also. So, ma'am, we are glad to have you here on this stage. We welcome you, ma'am. Dr. Kanchan, ma'am. Welcome to the webinar.
Thank you, ma'am. First, all of you, good evening from my side. And thank you for having me, myself, Dr. Kanchan Kholiya, Assistant Professor, Career Point University, Kota, Rajasthan. Today, I'm going to be speaking about the neurological consequences of long-term COVID. Before we'll move toward the topic or the title, I want to have honor toward all the senior dignitaries present here. Firstly, I thanks to Dr. Sanjeev Jha sir, who is President IAP, Ruchi Vashne ma'am, Dr. Hena Rajshekar, State Coordinator, Dr. Monima Bila ma'am, Dr. Vivi Manjula ma'am, and Dr. Samira Saira Fatima, and along with that, not at the last but not at the least, Himani ma'am and Aisha. Thanks a lot for giving me opportunity in this wonderful platform. So, like there is requiring so much arrangements to perform this type of platforms. So I'm very much thankful to the IAPWC Telangana state team. Thank you once again to all the participants for their valuable time here. So with this, we are moving toward the topic that is the neurological consequences. Let me share this slide. Okay. So when we are talking about the neurological consequences of long COVID, so here we are just connecting the COVID-19 with the brain, or how that COVID-19 is just affecting the brain, and what will be the neurological disorders as per the conflicts are there. So when we are talking about the neurological consequences, that after in the early stages, there will be more and more respiratory illness are there. But after many evidences by the researchers, they have researchers have been found as respiratory illness is somewhere related or somewhere conflicting the neurological disorders also. So this is what today's topic here. So in this pandemic, when we are talking about the coronavirus disease or the COVID-19 disease, so that is a pandemic, and we can say this is overall the world health crisis. COVID-19, when we are talking about the etiological factor, or when we are talking about the causative agent, that will be SARS-CoV-2. Somewhere it is, we can say, just genetically similar to SARS-CoV. There are other recent coronavirus outbreaks are also there. Hello, ma'am, am I audible? Ma'am, am I audible?
Yes, ma'am, we can hear you.
Okay, ma'am. Okay. So we are talking about the pandemic. So pandemic is that worldwide health crises are there, and there is different like coronavirus outbreaks are there in different forms. So the same thing by these different outbreaks of the coronavirus, like sometimes there will be the person suffering from the fever, like fatigue, and like we can say the lower respiratory system dysfunctions are to be seen more commoner in those type of patients. Including them, there will be the high rate of the pneumonia and the acute respiratory distress syndromes. That is what we are saying, the ARDS. So when we are talking about the long COVID as when the person is just having a persistent configuration of the disorder, so we can have the one of the stages there that is to be called as the long COVID, or we can say like persistent neurological manifestation when we are seeking toward any of the patient, and that is to be seen in a recent month. For example, there is having like certain type of symptoms like in the neurological consequences, like the headache are there, and sometimes hyposmia is also there, fatigue is also there, and sometimes sleep hygiene is also not well. Pain considerations are there, cognitive impairment are to be seen in the long COVID phases. So how that when we are talking about that coronavirus, how that is affecting the brain? Means how can we understood coronavirus is somewhere conflicting the brain, or somewhere it is conflicting like neurologically a person. So we are just having certain type of symptoms what we can see, or that is just concluding somewhere there will be a state of the confusion, somewhere there will be loss of the consciousness to the person, and sometimes some type of neurological illness or the disorders are to be seen in this case. So along not only that is the diversification of the respiratory disorders in the initial phase, but somewhere it is just leading to the some type of like neurological illness or neurological disorders, because somewhere it is just related to the when we are saying that somewhere the coronavirus is just affecting or conflicting the CNS or the PNS patterns of the in the human body. As now the thing is, what is happening in the brain when we are talking about that COVID, when we are talking about that coronavirus? So what is, how that is just affecting your brain? So we can say the patient who is suffering from COVID-19 or corona, we can say that is just the person is experiencing an array of effect on the brain. That is ranging from severity from the confusion level to the loss of smell and taste to, it leads to life-threatening conditions. Sometimes like neurological or neurological disorders. After not only in the that particular COVID-19 period, but also when the person is having long-term persistency in the recovering, so the person gets suffer from some type of neurological, neuropsychological problems also, we can have the weakness, we can have the brain fog. Means the person is unable to think anything, the person is unable to take any of the decision. There will be no any sleep hygiene is totally lacking in the person, and the fatigue is the common symptom in that. So these type of patients are to be needed to treat toward their neurological illness, such as the most common patient we are just seeking in that case, that will be the depression and the anxiety. Because due to the long term, we can say long COVID condition, the patient has suffered from many type of situations or unhealthy issues due to different concepts behind the theory or the pathological condition. Because of long duration of time, the patient sometimes gets suffered by depression or sometimes anxiety. So that is very important. If we peoples, when we are treating any of the COVID patient, as I have also seen post-COVID patients, in that what I have just seen, when there will be long-term duration of sickness is there, not only in the COVID, but the normal, if the normal condition is also there, the patient has suffered from somewhere the depression or anxiety. Means the person somewhere get confused, or somewhere the person is unable to take any type of decision due to the long duration of time of the sickness. So that is just similar to the COVID-19. Now, I have taken many type of different researches I have collected, and on those I have taken the incidence and prevalence rate. Were women were evaluated using the telemedicine in today's era. The most common comorbidity included, as I have said, the depression and the anxiety. Then many of the people are just suffering from like neurological symptoms. The common neurological symptoms are like the brain fogging. The person is unable to think about anything, and the person is not having a good decision power. The person is like 81% of people are suffering from brain fog. And out of them, like 60% of people are there who are having just mild to high severe grade level of headache. Sometimes, along with that, the person is having the complaints of numbness and tingling. The incidence and prevalence rate of that 60%. And 59%, the person is suffering from dysgeusia. Sometimes 55% the person is having anosmia or myalgias. Means strong, we can say there will be a muscle ache, or we can say like any type of like the person will suffer from, at the time the person will complain about the pain condition or the fatigue condition. Now, as I have said, the person is somewhere complain about the fatigue and the pain. So we can say the commoner symptoms which we are seeking, like the 85% of the complaints which we are getting in the patient of the post-COVID, or sometime we can say long duration of the neurological consequences, that will be like the fatigue and anosmia. So along with that, we are, if talking about the epidemiological, the clinical characteristic of the like COVID-19. So here, as I have seen many of the articles and the papers, some of journals, in that I have just taken an epidemiological study of that, and I have just analyzed the things which you can see in your front in the graph, that according to the year, there will be the implementation, what will be the degradation, what will be the promotion of the condition or the pandemic according to the year, you can see. Now, when we are talking about the word neurological consequences, when we are talking in reference to COVID-19. So as earlier I have told, that word is just interpreting toward the neurological signs by which the person is suffering from during the long period of the COVID. So as there will be sometime due to that, all the symptoms are due to damage of the, we can say respiratory centers, and sometimes there will be, if any type of neurological disorder are there, and infarction condition are there. So the person is, at the time, the person is sometimes also suffer from insomnia and many type of conditions. Now, how we can identify the neurological symptom of COVID-19? We have many type of neurological symptoms, or the patient when coming to us, they are just complaining various type of symptoms. How can we differentiate them? How can we identify them? That is the neurological symptom of the COVID-19. So as I have seen the patient and I have just concurred about their complaints, the common complaints, that will be like fatigue, which is, I have also collected the report about the articles in the journals. I have seen 85% of the person who are just complaining about fatigue. Then, if we are talking about the neurological consequences, the person is sometimes that they are giving the complaint of forgetfulness. They are just having somewhere illustration toward their memory, and they are unable to make their concentration in a proper one-center area. So we can say somewhere lack of concentration is also there, and the person is suffering from some type of sleep problems. If the person will not have a good hygiene, good sleep hygiene, the person automatically get disturbed from the health and also get toward the fatigue. Another thing, the common complaint, the person is just referring, that will be the muscle pain and headache. That will be from the mild level to the higher level. The commonest symptom which they are giving, that will be the loss of the smell or taste. The most common neurological consequences which we are seeing for patients of COVID-19 or long-term COVID-19, that will be the depression and the anxiety. Yes, these are the most common neurological consequences which we are commonly just seeking in their complaints. Or we can just analyze them, and we can if we will support them in the condition, or if we will treat them in that condition, they will somewhere return back toward their qualitative lifestyle. Then another one, persistent postural dizziness, and as there will be a progression about the disease and the neurological symptoms, somewhere the person's symptom get worsened according on the basis of the time, as that is firstly affected the physical health and mental health. Okay, so what will be, now we will see, like when COVID-19 is there, what will be the impacts on the brain? What will be the impacts on the brain means what we can see, how the function in the central nervous system or sometimes the peripheral nervous system is just affected. When we are talking about the neurological symptom of COVID-19, so there will be the two phases are there, central nervous system, and second phase, which just somewhere interrupting the function of the peripheral nervous system. So all the symptoms with the person is complaining, that is the dizziness, headache, impaired consciousness, inflammatory brain diseases, and acute cerebrovascular diseases, all those coming under the central nervous system, when the COVID-19 is just attacking to the central nervous system. In the other part, when the person is just having the impaired ability to taste, impaired ability to smell, impaired, somewhere if we are seeing the person is having the impairment, any type of impairment, or in the vision, or sometimes like nerve pain is there, that all the symptoms we all knowing coming under the peripheral nervous system. So somewhere the when we are talking about the COVID-19, so the brain is just affected by various type of consistencies, as the central nervous system get attacked, or sometimes the peripheral nervous system functionary aspect is get disturbed. Somewhere skeletal muscular injuries are also in the risk factors of that. Now, long-term impact, what will be, as I have told about the impacts of the COVID-19 on the brain, so there will be somewhere there will be long-term impacts are there, and sometimes short-term impacts are also there for by the COVID-19. When we are talking about impact, somewhere the person is 37.4% cases are just deficit and having complaints of insomnia and hypersomnia. According to various type of studies, we have seen, first of all, the person is just affected by the respiratory system, then it leads to some type of neurological symptom. Okay, when we are just talking about I have seen many as I have already told you about different articles and papers. In that, I have just taken a hypothesis that neurological symptoms might be a result of overstimulation of the immune system. So these scenarios are very entirely focused toward the practice of when we are treating to post-COVID cases, COVID cases, as per the neurological consequences. Now, meanwhile, short-term impact of COVID-19 on the brain, that will be like encephalitis, secondary, the acute ischemic brain stroke, then GBS, these are different like disorders are there, or we can say that is just affecting the person's life, and somewhere that is altering the lifestyle of the person. First of all, when there will be any type of like a temporary or the permanent residual damage on the cognitive or sometimes the accessory functioning of the brain. Okay, and sometimes we are seeking some infarcts are also there, and that is to be seen in all the ages, all the age group of the patients, with sometimes with having the comorbidities, and sometimes there is no any morbidity. Usually it is affecting the older age persons, but we can't say this is only present in the older persons. It is to be seen in all age group of patients. Now, I have taken a perception of researchers. Different researchers' perception are toward the COVID-19 impact. Before that, I have given what I have seen the impacts on the brain. Now I have taken the researchers' view, which is what they are just thinking. They are just referring about the COVID-19, how that is impacting the brain. So somewhere we can say it just lead to severe infection. Obviously, when there will be overstimulation of the immune system, so we can say overdrive of immune system. When there will be like chaos over the body. Okay, then another condition they have just pursued about the blood clotting abnormalities. So, like I have seen more than 20 articles or papers where the researchers' view are toward like these type of conditions toward the brain. Severe infection, when we are talking about the severe infection, so they have said about that the way how the virus is just entering to the brain, like somewhere that is invasive, and we can say that respiratory conflicts are the possible way somewhere, and they are just promoting, facilitating the capacity to enter the brain. And when the invasive characteristic of the infection will be there, then it will lead to some type of neurological disorders or any type of neurological consequences. One of the report I have seen in a paper, that is the report of case report in China and Japan, where they have just found the viruses genetic material in the spinal fluid. And one of the study where they have just taken a case of the Florida, and they have just found the viral particles in the brain cells. So this might be occurred due to the virus entering the bloodstream or sometimes the nerve endings. Okay, so somewhere we can predict by these cases that the virus somewhere entering into the bloodstream and all the nerve endings, and that is just affecting the brain. The symptoms, as we have discussed, the loss of smell or taste in some of the patients with the COVID-19 would indicate the virus entered through the olfactory bulb. When we are talking about the smell, and that is located right above the nose and information about the smell to the brain. Okay, so these are the common symptoms which we are seeking when the virus gets entered toward the tract. Then the overstimulation of the immune system, or we can say the overdrive of the immune system. What is that? This is the second possibility. Is the immune system goes into overstimulation, like when that is just fighting with the COVID-19 and just produces the maladaptation toward the inflammatory response, and that may leads to sometimes the tissue or the organ damage. So this is the second possibility where we can say that will be having the maladaptation toward the inflammatory response. So that leads to sometimes the tissue or the organ damage, and that is to be seen in various type of disorders or the disease. Now, chaos in the body. This is the third theory which I have found in the research papers. Due to the chaos in the body, they'll be having some type of physiological changes which are to be induced by the virus. And that is just somewhere ranging from high fever to low oxygen level. And sometimes that leads to the, due to the higher or overstimulation of the immune system, that leads to the multiple organ failures. And it just contributes to the account for the brain dysfunction. For example, we can have the examples like the person is suffering from sometimes the delirium or a coma. In the severe COVID-19 patients, the common symptoms which we are seeking, that will be the delirium and the coma. Now, another perception of the researchers is blood clotting abnormalities. When we are talking about the blood clotting abnormalities, that is the fourth way how the COVID-19 affect the brain. Like when there will be any type of abnormality relevant to like a clotting, that will obviously the patient suffer from any of the infarct condition, or we can say the leading pathology will be stroke. Blood clotting system in patients with the illness is highly abnormal with the clots. That is much more likely to occur in these patients than in others. Because at the time, the person is somewhere we can say the clots are just forming in the veins deep inside the body or sometime in the lungs, where they can just cut off the blood flow, and due to that cut off the उसका जो level होगा, जो blood flow उसका restrict हो जाएगा, that will sometime lead to the low level of oxygen. And due to this, we can say that stroke would occur, and somewhere it just block the we can say arteries, or somewhere it get narrow the arteries, and that leads to any type of brain conflicts, or we can say affection toward the brain or the brain abnormalities. Now, in the previous slide, we have somewhere seen about that COVID-19 is just conflicting the central nervous system as well as the peripheral nervous system. Now, how that COVID-19 affect the central nervous system, and what are the particular disorders which we are seeking when the COVID-19 is affecting the central nervous system? So we have the different type of disorders, diseases like the meningitis, encephalitis, encephalopathy, cerebrovascular disease, acute myelitis, demyelinating disorder, all which we are finding in the central nervous system functionary subsidiaries. Now, I have taken a whole mechanism how that COVID-19 is just affecting, as there will be initiating जो earlier symptom is there, that will be the respiratory disorders are there, and when the virus get entered over the respiratory tract, how can then that afflict the CNS? So tissue distribution of the host receptor is generally believed to decide the tropism of the viruses. As MERS-CoV, which exploits different like protein cells are there, and we have the like dense proteins are there. Okay, from the like we can seek out from the SARS-CoV-2 virus, which is just mined with high affinity to the type 1 transmembrane. So as similar to like angiotensin converting enzyme 2 is also there, which is just providing a mechanism of the viral entry, how the that virus get entered into the human cell, and that is just, we can say that is the entry point of the SARS-CoV. Another thing, like when we are seeking the angiotensin converting enzyme 2 is just negatively regulate the renin-angiotensin aldosterone system by degrading the angiotensin 2nd, and it just generates the angiotensin 1 to 7. These are the different like we can say proteins from the like different conditions, as we have the SARS-CoV-2, SARS-CoV. Okay, so that is just required to lower the blood pressure, and somewhere it also rapidly target the antihypertensive drug development. Now you can see here the current that is the effect of the SARS-CoV-2 and several potential targets for the therapeutic development to reduce how we can reduce the neurological consequences in COVID-19 patients. So you can see like neuroinvasion is there. Either we have the direct involvement of the neural nerve path we can use for that, and sometimes we are just focusing toward the blood pathway, and the indirect effects on the CNS when we are seeking like the conditions or the symptoms which we are like finding on the patient, that will be the hypoxia, sometimes hypertension and coagulopathy. Along with that, immune injury is also there. Along with that, direct and like indirect, we have many types of neurological disorders. Sometimes that neurological disorder get worsen, having the worsen condition, and sometimes that is having the easy return or easy recovery, and sometimes if that is long term or if that is the chronic in the chronic stage, the infection having many types of complications. Now you can see the post-COVID problems are there. I have taken a small chart for that, as we have the common neurological problems like the headache, and another thing, loss of smell, taste, loss of sleep, extreme fatigue, brain fog, and GBS, arterial and venous strokes are there, very common, and worsening of previous seizure or new onset seizures are there. Another neurological conditions are there, encephalitis, facial palsy, and much more complications of the brain like mucormycosis also seen in many of the patients. Now this, I have just taken the pathological condition along with the different neurological diseases so that you can know the pathogenesis. So you can see the chart and you can understand the pathogenesis and their neurological disorders or the diseases. Now, as we come to the part of the complication, as there will be the neurologic complication of the COVID-19, we have like the acute cerebrovascular diseases, encephalitis, GBS, and sometimes we have like there will be some drug interaction is also there, which is just combined with the pathophysiology. Sometimes there will be the damage of the receptors, and when there will be the means there will be alteration in the cytokines, or that sometimes leads to hypoxic condition to the patient. This is the diagram which is just showing the illustration of the COVID-19 related symptoms. Primary issues associated with the COVID-19 are just shown within the inner circle. You can see, and all these symptoms are widely reported in a large majority of the patient infected with the SARS-CoV-2. And as you are seeking the outer circle, that is the that is covered with a black sketch, that is just depicting the neurological issues or the symptoms that has been reported by many of the papers and in the patients after the COVID-19. So this is the inner circle, which is just showing the primary issues of the COVID-19 patient, and this is the outer circle, which is just depicting the neurological issues or the symptoms which we are seeing after the COVID-19. Now, what is the neurological manifestation in the COVID-19 patient? Like, what are the manifestations we have to keep in mind when we are just seeking the patient or the person who is suffering from COVID-19? there should be a better understanding of the neurological manifestation of the COVID-19 to seek out the patient, like post-COVID patient or the COVID patient. So the symptoms are just categorized into 3 categories, that will be skeletal muscular injury indexes, CNS indexes, cerebrovascular diseases, headache, dizziness, impairment, and like many more symptoms like consciousness, lack of concentration, seizure, ataxia, and along not only the CNS indexes, but also the PNS indexes also we have to see, like the nerve pain, impaired taste, smell, or vision. So for seeking out or emphasizing the COVID-19 patient or post-COVID patient, we have to capture some of the neurological manifestation regarding the patient or the sufferer. So this is what I have taken from the research studies, that out of the overall like we have the 78 patient in one of the study in the neurological abnormality, and another in that 25% of the sufferer are just having the symptom of CNS, and 11% is just showing the issue of the skeletal muscle injury, like the we have the pain and other conditions, and 9% are exhibiting the issues with the PNS functioning. So now one of the report by the WHO is there, who has just given like 2 or 3 cases out of like 2 or 3 cases. I have taken one of the case where they have just collected the 78 patients of that COVID, and they have just analyzed the condition, and on the basis of their amazement toward the analysis, they have just conclude the different category on the basis of the CNS indexes, PNS functioning, and the skeletal muscle injury and other primary issues. So the neurological symptom which will be more commoner, that will be same in the older patient, but we can't say that is only seeking in the older patient, that is to be seeking in all age groups. But in the patient, means older patients, it is to be seen more severely due to the high rate of infection, because they are just having some type of comorbidities such as like the hypertension, diabetes, malignancy, and like various type of cerebrovascular diseases are also there. Now the neurological consequences of the COVID-19 were apparent within the first 2 days of the infection or the cerebral vascular events, and whatever will be the impairment like the consciousness were often delayed beyond this acute time of period and associated with the increased mortality rate. Now this is all about like impacts, like a mechanism, and what is the neurological consequences, all I have covered. Now how can we manage that impacts? How can we reduce that impacts? We have to just focus the person toward different yoga therapies, different yogas to concur in the lifestyle meditation, so that they can just have the improvement toward the focus toward the any of the emphasize attention, concentration. Okay, so in the another way, we have to just recommend the patient about the brain exercises. So some of the we have to give the plan out, so that the person, if the person is just suffering from any type of depression or the anxiety, that return back to the normal lifestyle and have the qualitative in the future perspective. The most important thing in the as we are just helpful them for reducing the impact on my perception, the most important part to reduce the impact of the neurological consequences in the COVID-19, that is the personalized assessment. Different individuals have different, they have the different protocols, they have the different assessment on the basis of their nutrition, on the basis of their physical, psychological recovery. we are just reducing the impact of the peoples on the basis of their needs, and somewhere we can use the various type of brain mapping games, and we are just going toward the effective brain exercises by which the person can improve their brain. So by this, I'm just concluding my lecture on the neurological consequences of COVID-19. There are the references from where I have taken from WHO. I have referred for some of cases are there, some of papers are there. Thank you from my side.
Yeah. Thank you, Dr. Kanchan. Now I would like to request Dr. Sumeria to extend the vote of thanks. Over to you, Dr. Sumeria.
Dr. Sumeria, please unmute yourself.
Yeah, thank you so much, ma'am, for an amazing session. This was really helpful. I hope all the delegates got very much of information from your session. And I also thank the organizing team, IAPWC Telangana team, for organizing such a session. And lastly, but not the least, Dr. Ruchi ma'am, for giving us a platform to conduct such webinars and, for getting all of us together on this platform. Thank you so much, everyone. Bye.
Thank you, Dr. Sumeria. And yes, Dr. Kanchan, it was indeed a wonderful session, very informative. Thank you so much for sharing your knowledge with us.
Thank you, ma'am. Thank you, Hannah ma'am. Thank you, Manjula ma'am. Thank you, Himani ma'am. All of you, whole team, I'm heartily thankful to all. Thank you, ma'am.
Thank you, Dr. Kanchan.
Thank you so much, ma'am.
Thank you, Dr. Kanchan. You have given a lot of research inputs into this topic, and I'm sure it is going to be a great help to many researchers and neurological therapists who are working in this field. It's going to be very helpful to them.
Yes.
Thanks a lot for your inputs.
Thank you. Thank you all. Should we end the session, ma'am?
Yes, ma'am.
Thank you, Dr. Kanchan and IAP Women's Health Telangana State team for bringing this webinar, and thank you all again. Have a nice day.